Chapter 14, Point of Care Collection. This chapter is going to cover the terms, analyte levels that we will be determining for point of care testing, the most widely used application of point of care testing, and also define quality assurance and requirements in point of care testing environment. So with new and emerging technology, laboratory tests and services can be delivered beyond the lab, in patient hospital bedside, the emergency room, the home, nursing home, exercise or health clubs, and other direct contact patient settings. Terms used for direct laboratory services include point of care testing, decentralized laboratory testing, on-site testing, alternate site testing, near patient testing, and patient-focused testing or bedside testing. Point of care testing, the demand for point of care testing is increasing beyond rapid turnaround of laboratory test results is necessary. An estimated 12.8 billion laboratory tests are performed each year in the United States, with 1/3 of these tests involving point of care, which is very essential for those patients that need quick results. It also results in quicker decision making and turnaround times for patient recovery. Point of care testing. Point of care instruments use small amounts of uncentrifuged blood specimen. Point of care testing can use skin, puncture blood, urine, or saliva, and the specific regulations for point of care testing lies under the domain of CLIA. Table on page 460, box 14/1, there's frequently used point of care tests. So this could be urine dipstick, blood glucose analyzer, blood gas and electrolyte analyzer, hemoglobin A1c, coagulation test, and infectious disease testing such as influenza. These are the testing monitors and meters. We're going to also cover the types of tests as well. Hemoglobin A1c looks at a 3-month window of the regulation of a patient's glucose levels, just so you are aware. So in the box on 14/1, some common lab tests include a BNP, blood creatinine, eGFR, electrolytes and blood gas analytes, and glucose. Hemoglobin A1c, hemoglobin, infectious disease such as HIV, influenza A and B, lactate, lipids including cholesterol, HDL, LDL, and triglycerides, pregnancy, and white blood cell count. Glucose monitoring. In our class, we'll be performing a glucose point of care test. Diabetes is a chronic disease in which the pancreas cannot produce enough insulin or cannot use insulin that it does produce. Insulin causes the glucose to be absorbed from the blood into the body tissues and then used for energy. So the lack of insulin in patients with diabetes mellitus leads to increased blood glucose levels. So it's really essential these patients monitor their glucose throughout the day. The glucose analyzers and meters are small glucose monitor instruments commonplace in the home, nursing home, and hospital bedside. Their appropriate infection control and safety protocols must be followed. Please see table 14/1 in your textbook, which goes over the procedure for collecting a glucose sample, but we will also be performing this lab in class. Obtaining blood specimen for glucose testing, we're going to gather equipment, including a safety automatic lancet, identify the patient properly, briefly explain the test to the patient, clean your hands, and put on your gloves. It is really essential that we follow collection for a skin puncture, which was reviewed in Chapter 11. We're going to select the site and cleanse with an antiseptic, isopropyl alcohol, especially the side of the finger. Cleanse the skin with an alcohol wipe and allow the skin to air dry. We're going to gently massage the finger a few times from base to tip to aid in blood flow. We can also ask the patient to put their hand down because gravity will allow blood to pool to the fingertips. We're going to decide on which side of the finger to make the incision. Again, we want the medial surface of the third or fourth finger, and we want it to be perpendicular to the fingerprint. We're going to remove the safety lancet from the protective paper, hold the patient's finger firm with one hand, and make a swift, deep puncture with the retractable safety puncture device. In some cases, it requires us to wipe away the first 1 to 3 drops of blood. Please make sure that you review the point of care device manual to determine how many drops you need to wipe away. We're going to gently massage the finger from base to tip to obtain the needed drop of blood. We do not want to squeeze the fingertip. And in this slideshow, it talks about applying the Hemoq microcuvette to the drop of blood, and the correct volume is drawn into the cuvette. This is used for glucose or for hemoglobin determinations. Wipe off any excess blood from the sides of the cuvette and place the microcuvette into the cuvette holder and insert it into the photometer, and the laboratory test result is displayed automatically. And then you will document the results once you obtain it. We're going to discard safety automatically and sit in the sharps container with the biohazard label. Discard gauze, alcohol wipes, and gloves in the biohazard waste container, and wash or sanitize your hands. Glucose analyzer meter. Carefully read the package insert and user manual. Watch an experienced healthcare professional perform the test. And our instructors in our phlebotomy program will demo the procedure prior to students collecting it on their own. Strict follow daily quality control procedures and carefully record the results. Please review on page 464 quality and the point of care testing and disinfecting the point of care analyzers. We will be reviewing this in class, so please review this prior to your lab. Okay. Hemoglobin A1c, a reliable measure for glycemic control. The analyzer uses 1 drop of blood taken from the finger stick or venous sample, applied to reagent cartridge, inserted to a desktop instrument for analysis. It's really essential that for this particular test, they're looking at determining the average circulating glucose concentration over the lifespan of the red blood cells, about 3 months. So the use of hemoglobin A1c can offer greater clinical information than a single glucose result taken at a particular time. It's really essential for type 2 diabetic screening. Reproducibility of results. Purchasing reagent strips and controls in quantities to enable healthcare workers to use a constant pool of the same lot number. Preventive maintenance of each point of care instrument is critical for accurate results. We want to produce the same results, so it's really essential that we have the same lot numbers of our test strips and our controls. Routine cleaning of the point of care instrument. We're going to avoid transmission of nosocomial infections or hospital-acquired infections. We're going to use a cleaning tissue with disinfectant with a 5% bleach solution, and strictly follow healthcare institutions' policies for disinfecting analyzers and meters. We will disinfect the analyzer between each patient use. I want to review box 14/2, problems to avoid in point of care testing. We want to make sure the patient, we want to avoid patient misidentification. Specimen is appropriately stored. The blood is not contaminated with alcohol. This is where allowing it to air dry is essential. Blood is hemolyzed because the skin puncture was not dry from the alcohol after cleansing the site. The wrong volume of the specimen was collected. These are things we want to avoid. Instrument is not clean. The reagents are outdated. Reagents are not stored at the proper temperature. And results are not sent to the appropriate individuals in a timely manner. It is really essential you review this, box 14/2 in your textbook on page 466. Blood gas and electrolyte analysis. So blood gas analysis involves the measurement of PO2, PCO2, and pH. The PO2 and PCO2 are analyzed whenever a patient has a heart or lung disorder, and the blood pH determines whether the blood is too acidic or too alkaline. All these analytes must be closely monitored in emergency care situations, critical care units, cardiac intensive care units, and other units requiring immediate patient diagnosis and treatment. Point-of-care instruments can also measure a patient's sodium, potassium, chloride, and calcium, glucose, lactate, and hemoglobin. These electrolyte measurements are needed immediately in critical care situations. There's also the Roche-Trope sensitive rapid analysis. This is measurement of troponin T to detect heart damage. This is a future trend test, as well as giving us the ability to determine if the patient potentially might be experiencing a heart attack. Then there's the hemoglobin white blood cell system. It has a point-of-care test system for determination of white blood cell count for a patient. This can be found on page 467 in your textbook. The point-of-care analyzer requires only 10 ULs of whole blood from a finger stick or a venous EDTA tube. We can do blood coagulation monitoring, immediate results using controlling bleeding or clotting disorders in patients. QuagCheck XS system. And then there's very other point-of-care instruments that can be used. It takes only 8 microliters of whole blood, and you get a result within 1 minute. The other thing to be mindful of is this is generally done to measure the patient's PT-INR for maintenance of proper anticoagulant therapy. Hematocrit, HCT, packed cell volume, PCV, or CRIT, represents the volume of circulating blood occupied by the red blood cells. It is expressed as a percentage. Values obtained to aid in diagnosis and evaluation of anemia. As shown here in the image, it shows where the level red blood cell volumes are normal, anemic, acute blood loss, also low HCT and also seen in chronic anemia, and non-anemic but low HCT volume overload. So there is distinguishable ways to determine this. It can be done through a point-of-care system. Hemoglobin is more accurate than hematocrit and safer method to detect anemia. Hemoglobin procedure is a safer method because it takes the patient's whole blood sample, place the microcuvette, and insert it into the instrument, providing the patient's hemoglobin value. Instead of it being expressed as a percentage, it's represented as grams per deciliter. The ChemCard cholesterol test provides a semi-quantitative estimate of the total cholesterol in 3 minutes using a single drop of whole blood. Please be aware the high-density lipoprotein, or HDL, is referred to as the good cholesterol because increased blood values protect the patient from heart disease. The low-density lipoprotein cholesterol, LDL, is referred to as bad cholesterol since high values are linked to heart disease. And triglycerides are fatty acids and glycerol that circulate in the blood that are stored as body fat. So when performing the ChemCard, it gives you a total cholesterol value. It doesn't break down the components of the HDL, LDL. So keeping that in mind. Using finger stick drop of blood, the total cholesterol values are obtained using this machine. The HDL cholesterol, non-HDL cholesterol, LDL cholesterol, and triglycerides measured in 5 minutes from the blood sample, size of 40 microliters of whole blood. This is the Electrolyte LDX system. You will be performing an analysis and interpretation of cholesterol results in our lab. Other future point of care tests, there's the Billy check. This is measuring bilirubin in newborns. The measurement is conducted through neonatal skin and no blood is collected. Sometimes a newborn liver does not start functioning immediately and the baby becomes yellow or jaundiced. To determine if the bilirubin level is dangerously high, the physician will want the bilirubin test result. The device is held against the forehead and completes the test in 15 minutes. The liver breaks down bilirubins that can be removed from the body. And then we have here the Nova biometrical stat sensor point of care creatinine EGFR handheld EGFR analyzer available for whole blood creatinine testing. This is utilized as a quick method to measure the blood lactate level. In lactate can assist in determination the severity of bodily infections in patients. Then we have the HIV test on a USB stick. The device uses a drop of blood to detect HIV and then creates an electrical signal that can be read by a computer, laptop, or handheld device. It is a disposable test. And this technology monitors the amount of the virus in the bloodstream that helps with the patient's treatments. It is a disposable test. It cannot just be drawn and put in your everyday computer. It's a very special system that's used to analyze this. Healthcare workers must learn blood collection requirements, preventative maintenance, quality control, infection control requirements, ethical and legal implications, record keeping and calibration requirements when it comes to point of care testing. The other thing to be aware of is that for each procedure, there's a different collection requirements, preventative maintenance that we have to adhere to. So it is good to always keep up to date on the trends and changes. This concludes Chapter 14's narrated PowerPoint. Please make sure to view the study questions at the end of the chapter, case studies in action and practice, to prepare for your Chapter 14 test later this week.